Hello class, my name is Sarah Bilt. In today's presentation, I will be discussing alcohol's effect on the liver. For the outline of my presentation, I will be discussing what liver disease is, the vitamin A deficiency and alcoholism, and how to educate your patient on vitamin A consumption. First off, we're going to start talking about liver disease. We will be discussing the overview of liver disease, how alcohol is broken down, and the types of alcohol-induced liver damage. According to the Mayo Clinic, the liver is an organ about the size of a football that sits under your rib cage on the right side of your abdomen. The liver is essential for digesting food and ridding your body of any toxic substances, which will be excreted through the urine. Liver disease can be genetic or caused by a variety of factors that damage the liver, such as viruses, alcohol use, and obesity. Through this PowerPoint, we will be focusing on liver disease and alcohol use. Alcohol is broken down in the liver. A number of potential dangerous byproducts are generated when this happens, such as acetaldehyde and reactive molecules called free radicals. Free radicals are highly reactive molecule fragments that frequently contain oxygen. Small quantities of free radicals are produced as normal byproducts of various metabolic processes. These fragments are quickly scavenged by natural protective molecules in the cells called antioxidants, which we will be focusing on vitamin A. These dangerous byproducts contribute to alcohol-induced liver damage. Since the liver can regenerate itself, when we see alcohol-induced liver damage, usually the liver has exhausted itself and will no longer be able to regenerate. According to the National Institute of Alcohol Abuse and Alcoholism, there are 3 types of alcohol-induced liver damage. The first type is fatty liver disease. This is when fat deposits on or around the liver. In some degree, this happens in almost all heavy drinkers. It also could occur in non-alcoholics after a single drinking session. Fatty liver is reversible and is not believed to lead to more serious damage. The second type of alcohol-induced liver damage is alcohol hepatitis. This is inflammation and destruction of the liver. Scar tissue may begin to replace the healthy liver tissues in a process called fibrosis. Symptoms of alcohol hepatitis may include fever, jaundice, and abdomen pain. This condition can be fatal, but may be reversible with the absence of alcohol. The third alcohol-induced liver damage is alcohol cirrhosis. This is the extensive fibrosis that stiffens blood vessels and distorts the internal structure. This happens in almost 15 to 30% of heavy drinkers. Next, we will discuss vitamin A deficiency and alcoholism. According to the National Institute of Health, vitamin A is the name of a group of fat-soluble retinoids. Vitamin A is involved in immune function, vision, reproduction, and cellular communication. Vitamin A is crucial for vision as it is an essential component of rhodopsin. This is a protein that absorbs light in the retinal receptions, and because it supports normal differentiate and functioning of the conjunction membranes and the cornea. Vitamin A also supports cell growth and plays a crucial role in the normal function of maintenance of the heart, lung, kidney, and other important organs. It has long been recognized that all alcoholics are generally malnourished and suffer from vitamin A deficiency. Alcohol consumption has been associated with the declines of the hepatic levels of retinol, as well as retinol esters and retinoic acid. This is collectively referred as retinoids. Common consequences alcoholics often face with the vitamin A deficiency is the loss of night vision. since vitamin A is connected to retinoids, vision can be compromised. While this manifests in vitamin A deficiency, it can be relatively mild, but oftentimes vitamin A deficiency can lead to blindness. Other signs and symptoms you might see with vitamin A deficiency is dry skin, dry eyes, night blindness, infertility or having trouble conceiving, delayed growth, poor wound health, throat and chest infection, along with acne and breakouts. Moving forward, the rest of this PowerPoint will be discussing the education on vitamin A consumption. The recommended vitamin A intake is listed below. I would like to point out RDAs for vitamin A are given as mcg of retinol activity equivalents, which is RAE. This is to account for the different bioactivities of retinol and provitamin A carotenoids. I will allow you a couple seconds to look at this table listed below. Some sources of vitamin A. Concentration of vitamin A are at the highest in liver and fish oil. Other sources of vitamin A can be found from milk and eggs. Most dietary vitamin A comes from leafy green vegetables, orange and yellow vegetables, tomato products, fruit, and some vegetable oils. The top sources of vitamin A in the U.S. dietary include dairy products, liver, fish, fortified cereals, carrots, broccoli, cantaloupe, and squash. Some other sources of vitamin A may include 1 whole sweet potato, 3 ounces of beef liver, half a cup of boiled shrimp, or half a cup of carrots, 1 piece of pumpkin pie, half a cup of cantaloupe, half a cup of peppers, 1 whole mango, 1 cup of black beans, 10 halves of apricots, half a cup of broccoli, 1 cup of ice cream, French vanilla, 1 cup of cheese, 3/4 of a cup of tomato juice, 1 cup of fat-free or skim milk, 1 large boiled egg, half a cup of summer squash, 3 ounces of salmon, 1 cup of plain yogurt, 1 ounce of pistachios, 3 ounces of light tuna, or half a chicken breast. As future registered dietitian nutritionists, it is our job to educate these patients on the recommended serving sizes, like the table shown before, give examples of vitamin A sources, know the importance of vitamin A and how it could affect our body if we lack it, along with being supportive and patient. It is also good to consider that these patients may have never followed a regular diet plan, so it's our job to educate them on how to include vitamin A into their diet. It is also important to consider that these patients may have never been educated on the lack of vitamin A and to identify these barriers if they have not done so. Overall, the goal to helping these patients with their vitamin A deficiency is to just be supportive and understand that what they are going through, it can be very hard. Here are my references. This concludes my PowerPoint on alcohol's effect on the liver. I'd just like to thank everyone for listening to my PowerPoint, and if you have any questions, you can find me at the email listed below. Thank you so much for listening, and I really hope you learned something.